Hello everyone, how are you today? I am Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel, and today I am going to talk about height. This topic has been requested so many times and finally we are addressing this issue. We are going to deal with this topic in parts. First, I will talk about how tall can you be? How tall will you be? Can you predict that? What determines that? What changes that? And what are the key factors, right? And lastly, I'll give you a formula to actually predict your height or height of your children. So let's start.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Many people say that your height will be just as much as your parents, but it's not just that simple. An adult height depends upon a number of factors, right? First is your height and weight growth pattern. Second is early or delayed growth of family members. Third is your puberty duration, puberty time, onset. And fourth is your chronic illness. If any illness if you have, then that can decrease your height. And fifth, most important thing is your nutrition. Nutrition is most important, and there is a sixth factor, exercise. Although in childhood, in teenage group, exercise is very commonly done. Okay, so there are these six factors which actually determine how tall or short will you be, right? Height and growth pattern, your delayed or early onset of growth of your family members, puberty duration, chronic illness, and nutrition and exercise, right? So can you figure out how tall you'll be? The best way is to look and review your growth chart with your doctor. Only then you can actually precisely predict how tall you're going to be. And how is that done? Your doctor actually tracks your height at every checkup, height, weight, right? They plot your height and weight on a chart, and then they know what is the typical for a healthy boy and girl of your age and at what percentile are you there. So how much can you actually grow on the basis of your progress? That is the best way. Healthy children tend to follow a curve on the chart that is largely set by their genes. So your genes play a big role here. You can also do a little math by yourself, but you will need to know how tall your parents are. That is most important. For a girl, how you can predict the possible height is take the father's height, subtract 5 from it, and then add mother's height, divide this by 2. This becomes the possible girl's height. For boys, you can take the mother's height, add 5 to it, and then add father's height and then divide by 2. So this becomes boy's height. Then people say, if my parents are actually short or tall, will I be just like them? Maybe, probably, because your genes which you get from your parents play a big role in your growth patterns, and your final adult height also depends on it. But it's not the only factor. Remember that. All those things which I just said are big factors. So you can actually increase your potential height by proper nutrition, proper exercise, proper rest, preventing illness, and tracking your growth. That's the important stuff, right? So if you do want to increase your height, in the growing ages, in your childhood, in the teenagers, the best thing you can do is take more proteins. Some people say eggs will increase your height, some say bananas will increase. The idea is a good nutritious diet is important. High protein diet is important. You need to take at least 30 to 35, sometimes even 40% of your calories from proteins. So that is important. Carbs are also important. So that's the macro which you need to follow in a childhood. 30 to 35% of your diet should be proteins, and then 40-45%, 50% should be carbs, and the rest should be fat. That's the average amount, that's the idea, right? So protein intake needs to be increased, no matter if it is a plant source or an animal source. The only difference is animal proteins are usually complete proteins. They have all the necessary amino acids. In plant proteins, they are incomplete proteins, so you have to make sure that you are eating variety of plant sources. You cannot eat just one source daily and expect to get results, right? So a variety of plant sources, animal sources, protein sources can be taken. Check out my video on lean protein if you don't know what options of proteins you should use. Peanut butter is very good for children. Peanut butter can be given to children's eggs, fish, chicken, mutton, meat are very good if you can give them. Milk is utmost important. Milk is important. Milk, fruits, then lentils, right? Whole grains. These are all very important. Dry fruits, nuts are important for their growth. So give them all these things in ample amount so that it helps their growth and development, and let them play. Let them play outside. It's important for them to play, jump, right? Run fast so that their growth is stimulated. So that's all, guys. And remember, puberty is the biggest time. 8 to 13 years of age for females, 10 to 15 years of age for males. This is the average amount of puberty. It can vary in everyone, but it can vary in case to case basis. But around this age, you have to take care of your diet and exercise. Don't fall ill. Don't be depressed. Happiness, your mood actually stimulates your growth. So all these things are important. Make sure your child is not stressed, not anxious, not pressurized by peer pressure or studies. It's important to be calm, quiet, relaxed and happy. Joyous child will grow and prosper. That's your job as a parent. That's your job as a person. So that's our job as human beings. So take care, guys. This is all about height, how to increase, part 1. In the next part, I'll talk about whether and how to increase your height after puberty, after 20s. So take care, stay connected, stay healthy.